Hi, I'm Dr. Harry Lausen. I'm the Chief Medical Officer for SIU Medicine, and today I'm joined by Dr. Ricardo Loret de Mola, who is our Department Chair of Obstetrics and Gynecology. Welcome, Dr. Loret de Mola.
Thanks, Dr. Lawson. Happy to be here today.
Great. We appreciate you being here. Today, we really want to talk about a topic that hasn't been covered regarding COVID, and that's our patients who are pregnant or are going to be delivering very soon. And so we wanted to make sure we cover some of the questions that we've received, and we have quite a few. So we'll get right into it. The first question we have is kind of general, but what do we know about COVID-19 and how it impacts pregnant women in general?
It's very interesting. We have had a recent report that came from China that shows that out of 49 women who delivered their babies being COVID positive, the babies were fine and women did fine. So there seems to be a feeling that the virus does not affect pregnant women as much at this point. However, there are some more recent reports that after delivering, patients could potentially decompensate. And therefore, we have to really keep an eye on those patients after delivery to make sure that their respiratory symptoms don't decompensate during after the delivery.
So we're really needing to keep close contact and in touch with patients after delivery because they could get really sick.
Yes.
Does that happen frequently?
We don't think it happens frequently, but when it does, it tends to be pretty severe. Okay. There must be something about the immune system that sort of changes, that provides protection during pregnancy for both women and the baby. And yet, when the baby is delivered, that sort of protection inherently disappears very quickly. So patients could decompensate. Plus the body, women's bodies change so much in preparation for the delivery that those changes appear to be such that they're not well compensated and they could precipitously get sicker.
Okay. Well, along those same lines, what are the risks or complications we might see for the newborn after delivery?
Well, and that's the most amazing part. Babies seem to be fine. Babies do okay. Even when the mom is positive, babies seem to be okay. It may be that moms start developing a little bit of an immune response to the coronavirus and some of these antibodies crossing to the baby and giving the baby some level of protection, perhaps. We don't know. But the interesting thing is they do fine. They don't seem to contract the disease. And we do know that the virus doesn't cross the placenta, so the virus doesn't really get into the baby, which is really an amazing thing.
Well, and that does actually cover at least one other question we had was, does it cover that, does it cross that placental barrier? So while the baby's inside mom, that virus isn't getting from the mom to the baby.
Well, the most protected people in the planet right now are babies, because this virus cannot get to them.
How about another question along those same lines? Mothers that are breastfeeding or the breast milk itself, do we know if the COVID virus passes in that sense?
There is some mixed information. It appears that it doesn't, but it's really unclear. The current recommendation is for patients to not breastfeed if they're infected with the virus.
Something that's really important, I think, for pregnant women who are getting close, especially to their delivery time, what are the special precautions that are being taken in hospitals while women are giving birth now?
If there's anything out of our conversation that I'd like our patients to take, is that the safest place to have your baby is still the hospital. We're taking every precaution imaginable to keep you and your baby safe. Everybody's wearing masks. We're protecting you by wearing masks during labor, which sometimes can be difficult for patients to accept and understand, especially when they're breathing very heavily. But it's again for their protection. We're using full PPE, which is personal protection, so doctors, nurses, everybody's completely covered to be able to keep you safe. As we mentioned before, patients could decompensate quickly. We're there for you. If you decompensate, will be on top of it to make sure you're safe. It is a huge concern right now that patients choose to deliver at home. When you deliver at home, you have none of those protections. And you could decompensate very quickly and not have all the resources that you need to be able to be safe, both you and your baby. There's been now reports that I've had from other department chairs from the New York City area where there's been moms and babies who've died in New York City with some of the best healthcare available in the world, dying because they've chosen to stay at home. Our hospitals are safe. The doctors know what they need to do to keep you safe and to keep your baby safe. Please do not deliver at home. Come to the hospital. You have nothing to fear.
Yeah, and I think that's a really important point, that we've prepared and taken all the precautions we can, especially in the hospital, but even in our clinic spaces. Now when you visit our clinic spaces, if you have a regular visit for your pregnancy or you have an appointment for an ultrasound that you have to have, everybody's in masks, and we're taking all those precautions to make sure that we're keeping everyone safe. And so that's a really great point.
And it's important for everyone to understand that our most important task is to keep you safe. So we'll do everything we can, both our local hospitals and with SIU Medicine, to keep you safe.
We've got another question, and I think we've covered several of the next questions in that last answer. How likely is it that hospitals will move toward restricting all visitors, even the spouse that might be present?
And that's another big concern that patients have. The hospitals are allowing one visitor to be with the patient during the whole delivery process and in the postpartum period, but they're asking that only one person is consistently the same person throughout the process, again, to reduce exposure to the population of a potential contraction of the disease. This is the same for prenatal visits. At SIU Medicine, we're allowing one person to come to the visits with the patient. We're asking to please bring some type of protection, either a mask or a bandana or something to protect your nose and mouth to reduce your ability to transmit this to some other people. We are asking for symptoms of the coronavirus before they get to the building. We're asking to wear personal protection in their face. If they don't have any, we are giving patients masks to be able to keep them safe. We're asking for social distancing in our offices, only one person at a time, and we're minimizing contact. But we want you to come to your prenatal visits. We're spacing them out a little when we think it's safe to space out, but we're not changing anything for patients that are high risk. So if you're high risk, if you have a medical problem, we're going to keep your care the same. First and foremost, we want you to be safe.
Right, and those are all great points. We've really taken a lot of precautions at SIU Medicine across all of our sites to do exactly all of those things to make sure that you're safe. We've also reduced the volume of patients we're seeing. But patients that have urgent needs or necessary follow-up visits, like during your pregnancy, we're going to definitely still see you. So we just need to make that clear that we will definitely see every patient that needs to be seen. We're trying to reduce the number of patients who maybe have a routine visit or a normal follow-up that we can handle using some other method like the telephone, a smartphone, a computer, a telehealth visit, something along those lines, and only trying to bring the people into our space that really need to be seen.
And I think we need to emphasize the telemedicine visits. For certain situations, and that's probably over half of our visits, we could safely do that via telehealth with a video camera, with a microphone, or even over the phone to just make sure that your needs are being met, that everything is going well with your pregnancy. Something very simple that you can do at home when you're pregnant is just simply count how many times the baby kicks. Doesn't cost any money, it's very simple. And we know that kick counts on babies are a very good way of knowing that the baby is doing well.
And you've had some experience yourself delivering some telehealth visits. How do your patients react to it? How do they like it?
Well, it's very interesting how these patients, especially the people that are not within Sangamon County, they absolutely love the idea of not having to drive in. It saves gas, it saves time, it's simple, and we can do essentially 90% of what we normally would do during those visits. Patients are very happy that they're choosing this route, and I think it's here to stay. I think that now patients are going to be requesting these visits, so we won't be necessarily offering them. Patients are going to demand them, and that's great, because I think it's a great method for us to reach out, especially our extended communities. And who knows? I see patients who come from all over the world. I think that this is just going to open another door.
That's great. Let's move on. You kind of touched on women potentially skipping a prenatal appointment, and I think the point that you made was there might be some spacing that's allowed, that you'll work out with your obstetrical provider what that might look like. But obviously, the patients that are at high risk or have urgent needs, we're going to see them as needed, right? Mm-hmm. How can couples prepare for labor and delivery now that the sort of the in-person classes and coaching, they're not really going on? So how would you recommend that couples prepare?
Well, there's a lot of negative things about the internet, but if there is one thing that's good about the internet, it's resources. There are a wonderful amount of videos available for preparation for delivery, preparation for the hospital, YouTubes. But another great resource is actually the American College of Obstetricians and Gynecologists, or ACOG. The website is www.acog.org. And there is an incredible amount of information for patients there that they can use to prepare themselves. The preparation is the same. The only thing that's going to change is how we're going to do the preparation via electronic devices.
Okay, great. So a lot of internet resources, and I'm going to repeat the website just in case, www.acog.org.
Yes.
Okay. This is an interesting question, but it's one that needs to be answered. Should couples put a pause on trying for a baby right now?
As you know, I'm a fertility specialist, so I get that question about 100 times a day. So the answer to that is yes, put a stop. Why? Because we simply do not know. We will have the data in 9 months.
Right.
And I have to remind people of what the Zika virus was to couples just a couple of years ago. It wasn't that long ago that unexpectedly this simple infection borne by a mosquito caused devastating damage to a whole generation of people in South America. So I would caution patients, at least for the next couple of months, to avoid getting pregnant because of that potential risk. Now, we do know the virus doesn't cross the placenta. We do know that babies appear to be safe in the 3rd trimester. Is that the case for the 1st trimester? We just don't know. And I think a delay of 2 or 3 months to have a child will not affect anybody's chances of getting pregnant in the future. So that very small delay, I think, is going to prevent a potential disaster for a child, years of pain for patients and their partners, but more importantly, it will not affect their chances to getting pregnant in the future.
Another item that we have here is, I've heard testing for COVID-19 is limited. Does being pregnant make it more likely that I would receive a test as a pregnant patient?
The answer is no. We're going to follow your symptoms. We're going to ask the same questions when you're pregnant, and if you meet the criteria, then yes, you will get a test. But we're not going to do tests just because you're pregnant, because there is really no advantage to doing that, number one. And number two, we do have a limited amount of these tests available, and we want to reserve them for the people who really need them.
Yeah, and I think that's an important point too. right now our approach to dealing with this is limited by the number of tests we have. And certainly the testing has been directed to areas that have been hit harder.
Yeah.
You know, we know those cities in the U.S. that are really struggling with this right now. At some point, we may have a test that's more available, but right now we're really trying to test those that are very ill, that might be in the hospital, so that we can, number one, understand what their course of illness might be, and number two, the sooner we know if someone's negative, the less amounts of personal protective equipment we have to use.
Absolutely.
And that sometimes is difficult to get.
Yes.
And so we don't want to run out of the PPE until this is well into the recovery phase of this pandemic. So
And
we
I
just
think
wanna
it's
make sure about
important
that.
for the public to know. I mean, if we could, we would test everybody.
Right.
We just don't have the ability to do that. So we have to reserve it for the people who need it the most. So maybe things will change. Maybe they will not. But at this point, we're only going to test people who really need to be tested.
You kind of covered this a little bit, but I'm going to go ahead and ask this question. Does trimester affect a woman's likelihood of getting sick or having COVID-related complications? And it says here there's a subset of question. From what I've read, third trimester is most at risk for women already having a difficult time of breathing because their body changes, things change. So are third trimester pregnant patients at more risk of having the COVID or at a higher risk of having complications because of COVID?
So again, the risk of getting the infection is the same as the general population. So getting infected is the same, it depends on your exposure. During labor, it appears that women do pretty well, and so do the babies. They don't seem to have more difficulty other than the normal difficulty that you expect from being pregnant and the discomfort from sort of that space occupying baby that you have. But it doesn't. The problem appears to be for some patients who are infected, who would potentially decompensate after having the baby, but only women who are infected with the virus, which are actually in our community very, very few.
This is also something we've talked about, but again, I think it's worth repeating. How often should pregnant women see their doctors in person during this pandemic?
Again, it depends on which trimester of pregnancy we're talking about. So in the first trimester, probably 6 weeks or even 8 weeks is probably okay, provided that the patient is having no symptoms, they're having no vaginal bleeding, and have no other symptoms that would suggest that there's a problem with a baby or a miscarriage. Second trimester is the most quiet time in pregnancy. So probably again, 6 weeks apart is perfectly reasonable. We will want to know at some point via ultrasound the gestational age of the baby and that the baby is structurally normal. So a second trimester ultrasound is something that we do routinely, somewhere between 14 to 16 weeks. Right now we're moving those to 20 to 22 weeks to try to give a little bit more space. We will get the same amount of information, it's just going to be delayed a little bit. And now in the third trimester, I think visits are going to be in the beginning a month apart. Weeks, visits that we were doing every other week, maybe we could space every third week. And the weekly visits that we do in the last month of pregnancy, we probably could do a week and a half. Again, this would be for low risk pregnancies. High risk pregnancies, no change.
Right, okay. So one last question that we have, and then we'll get into some general comments. Is SIU still doing ultrasounds for their patients?
Absolutely. Ultrasounds are still being done. We're seeing high-risk pregnancy patients. None of that has changed. The only thing that's changed is the spacing between the tests that we have extended a little to try to accommodate everybody. But those high-risk pregnancies, we're seeing them no different than we were before.
Okay, great. Well, I think we've covered a lot of topics and a lot of questions here today. Are there any other general things you would like to communicate to our our community or the community surrounding us that we serve, specifically about our patients that are pregnant?
I think number one, you have to remember that everything we do at SIU Medicine, we do for you. We're going to take every precaution to keep you and your family safe, especially your baby. Number two, we are taking care of pregnant patients, no different to what we were doing before. Please, please do not try to deliver at home. At this point in time, it's probably not a good idea. If you happen to be infected with the virus, you're certainly much better off in the hospital. We have special rooms with negative pressure where we isolate those patients from the rest of the patients to keep everybody safe. It is the safest place for you and your baby. It was the safest place before coronavirus. It is the safest place to have a baby today, and it will continue to be the safest place to have children in the future. That's not going to change.
Great, thank you. So Dr. Loret de Mola, thank you very much for joining us today and providing a lot of information for our patients who have concerns during their pregnancy in this COVID pandemic. We thank you for watching the video, and as always, be well, stay apart, and wash your hands.